Hi, good morning everyone. My name is Dr. Garima Yadav and I'm a second year child and adolescent psychiatry fellow at Texas Tech, Permian Basin. Today I'm going to talk on a topic which we know millions of people around us end up facing. So let's say it's normal to feel nervous in some social situations. For example, you're going on a date or giving a presentation, talking to new people, and you get those weird butterflies in your stomach. So what is social anxiety disorder? And you may also know it as social phobia. Everyday interactions cause significant anxiety, self-consciousness, and embarrassment because you fear being scrutinized or judged negatively by others. So in medical terms, social anxiety disorder or social phobia is a mental health condition where you experience intense and ongoing fear of being judged negatively or being watched by others. It is a common anxiety disorder. So if you feel you have social anxiety disorder, you have anxiety or fear in specific situations or all social situations, including meeting new people, performing in front of people, taking or making phone calls, using public restrooms, asking for help in a restaurant, store, or just dating, answering a question in front of people, going up and talking to new people, eating in front of people, participating in an interview. A core feature of social anxiety is that you're afraid of being judged, rejected, or humiliated. So, who does social anxiety affect? It is a very common mental health condition and it can affect almost anyone. Generally, females are most commonly affected than males. And generally, social anxiety disorder can come in early to mid-teens and can sometimes also start in younger children. Most people who have social anxiety disorder experience symptoms before the age of 20 years. So how common is it? Approximately 5 to 10% people across the world have social anxiety disorder. It's the third most common mental health condition behind substance use disorders and depression. So another one of the questions which you might be having and wondering about is, so what is the difference between social anxiety disorder and just being shy? So as you know, anyone can experience shyness from time to time. Having social anxiety disorder consistently interferes with or prevents you from doing everyday activities such as going to the grocery store, talking to other people. Because of this, social anxiety disorder can negatively affect your education, career, and personal life. Being shy from time to time doesn't affect these things. So in general, there are three main factors that distinguish social anxiety from just being plain shy. That is, how much it interferes with your day-to-day life, how intense your fear and anxiety are, how much you try and avoid certain situations. Many people with social anxiety don't know that they are suffering from it and sometimes feel they're just shy and they don't go out and seek treatment or help because they think it's a part of their personality. So what are the different types of social anxiety? A person with social anxiety can have anxiety varying from mild, moderate to severe. Some people can experience social anxiety in one situation like eating in front of others or talking to someone new, and some people can just experience it in all sorts of situations which they encounter on day-to-day basis. So a person with mild social anxiety may experience the physical and psychological symptoms of social anxiety but still participate in or endure social situations. They may also experience symptoms in certain social situations only. A person with moderate social anxiety will have these symptoms but might participate or not participate in the situations that cause him anxiety. An extreme social anxiety person may experience more intense symptoms such as a panic attack in social situations. Because of this, people with extreme social anxiety usually avoid social situations at all costs. A person with extreme social anxiety likely has symptoms in all or many types of social situations. It's very common to have anticipatory anxiety when facing these situations. It's possible to fluctuate between different levels of social anxiety. Like sometimes talking to some new person may give you extreme anxiety, but when you're going to a grocery store might not, and you can endure the situation. So you'll fluctuate time to time between different types of anxiety levels. no matter which type of social anxiety you have. It's important to seek treatment because this type of anxiety affects your quality of life. So, what are the different behavioral and emotional symptoms that you may experience and will classify you or diagnose you with social anxiety disorder? So, these are constant symptoms like fear of situations in which you may be judged negatively, worry about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fear that others will notice that you look anxious, fear of physical symptoms that you experience when you're anxious, like you start sweating, you're blushing, you're trembling, having a shaky voice, avoidance of doing things or speaking to people out of fear of embarrassment, avoidance of situations where you might be the center of attention, anxiety in anticipation of a feared activity or event, intense fear or anxiety during going to weddings, meeting your family members, analysis of your performance and identification of flaws in your interactions after a social situation. So you'll end up thinking, oh, I spoke to this person. What did that person think about me? How did they feel? Did I look good? Did I feel bad? So you'll have this weird thread going in your head which will not stop. So what is the difference in anxiety between children and adults? For children, anxiety about interacting with adults or peers may be shown by crying, having temper tantrums, clinging to their parents, refusing to speak in social situations. There's a different type of social anxiety, also known as performance anxiety, in which when you experience intense fear and anxiety during speaking or performing in public, but not in other types of more general social situations. So the next question which arises is there a specific test for social anxiety disorder? Healthcare professionals and psychologists can use certain tools or diagnostic tests, usually a series of questions, to learn more about what you're experiencing to gauge whether or not you could have social anxiety disorder. Based on the responses, your healthcare provider can then make a social anxiety disorder diagnosis. Is it treatable? Of course, it's treatable. So there are two types of treatment which you can pursue if you have a social anxiety disorder. One is therapy, like cognitive behavioral therapy, or medications such as antidepressants, typically SSRIs or beta blockers, can be used for treating social anxiety, and they work very well. So when should you see a healthcare provider? So if you're experiencing signs or symptoms of social anxiety disorder, you need to talk to your healthcare provider. Treating social anxiety is crucial to feeling better and reaching your full potential. If you've already been diagnosed with social anxiety disorder, be sure to see your healthcare provider regularly. Go for your therapy, take your medications on time. And if you feel your symptoms are worsening or you feel suddenly you have developed new symptoms, you need to contact your healthcare provider as soon as possible. Don't discontinue medications on your own without discussing it with your healthcare provider first. So please go see a healthcare provider and go achieve your full potential. It is treatable, so please do that. Thank you and have a good day.